So, hi everybody. Hope you're doing well. Got a lot of updates, and I finally did analyze that article. I probably should not have, but I promised I will talk about it. It's kind of scary article, but I will try to unscare you. Okay, how about that? And of course, since it's a Halloween, I think it's quite in theme to get scared about zombification effects of the COVID vaccines. As you will see, there is no statistically significant increase in how many zombies vaccines have created, but we will see what's real and what's not in a second. Meantime, so you know the drill. Drop the questions in the chat. I have a number of updates. Let's start with the testing. We talked about the test last time. There's more data on them, so I just put the link if you're interested in taking a look. So the combo test for the flu, both influenza A and influenza B in combination with COVID is out. It looks like their quality is pretty decent. There are multiple tests. The article tells you which ones FDA approved, which are not. I'm not going to get into that. I don't know. I don't even know if that really truly matters. But nonetheless, you can take a look at the link. So the good news is they're very specific. So what this means is when the test is positive, it's guaranteed that you have a problem. So both COVID and flu have about 99% specificity. The sensitivity is at around 90%, 90 to 92. It's actually pretty good. It means that only 1 out of 10 tests is going to be falsely negative if you collect the samples correctly. So to collect the samples correctly, you really have to follow instructions. The best way to do this is really the way I kind of tell to everybody: when you put the swab up your nose, if no pain, no gain. Okay, so if you're not feeling it, you're not doing it right. You really need to get close to almost gagging and this kind of very uncomfortable sensation, because you need to get pretty high up. Now, obviously, you don't want to cause any trauma or any bleeding, but you need to be pretty aggressive at getting up there and swabbing the upper nostrils all the way as they suggest on the picture, and then following the rest of the process. So that's the first. Now there's increasing number of kits that are outdated, what we call expired. I still suggest, and there's been several articles saying, don't worry, just use them as long as the positive control lights up. It's fine. The test is valid. If the positive control is negative, you cannot use the test. You have to throw it out and find the one that doesn't do that. Okay, so that's one. So Cecile, thanks so much for putting that comment that some libraries still carry the kits. Grab them. Wherever you see the kits, grab them. Grab as many as you can. Use the ones that are closest to expiration dates already expired first, and keep the ones, but don't throw out any kits at all. Even if they already expired, they're probably still okay to use. With a caveat, again, remember, if the control is negative, if it doesn't give you a strip, you need to throw that test out and find the one that doesn't do that. What's criteria are they using to measure zombification? I don't know. We'll have to figure that one out. All right, let's talk a little bit about an article. And what I have to do is to put screen on. You guys, somebody let me know if you see my screen now. So I'm going to enlarge this. Is that good? Can you see the screen?
Yes.
Okay, thank you. Okay, so this is the article. It's definitely the largest. I doubt that something like this will be repeated. We're talking about 100 million people. Most of them were in Europe. And the reality is that they looked at every vaccine that was available at that time. For the time of the study was, let's see, this was published very recently, but the collection of the samples was done, I believe, yeah. So it was started in 21 and then continued until they finished the number of samples collected, which I believe was in 23. Yeah, as of November 2023, this is when they finished the collection of data. So I'm going to only concentrate on important points, okay? So what did they overall, in just 2 words, where the zombification is coming? Whenever you're seeing the numbers that are showing more than 1 in the odds ratio, see this 2.49 right here for Guillain-Barré, it means it's significant. What does that number mean? It means that the risk of Guillain-Barré is 2.5 times roughly higher than if you don't take a vaccine. Okay, that's the zombification scary part. So the scary part, you can see that a lot of things happen. 4 times more encephalitis. Let's see. There was cerebral, clots in the brain were 3 times more higher. And there were some other things like this. Now, so that's a scary part. So the scary part, there were and there was myocarditis and pericarditis. So inflammation of the heart was observed. What's the odds ratio? More than 1, so 50% higher rates. So you should say, oh my God, you know, now nobody should be getting vaccines. Okay, so that's the scary part. Now, unscary part. Now you have to think, what does that mean? So if I tell you that the risk of Guillain-Barré is 1 in a million, is it truly important that now your risk is 2.5 out of a million, right? Because again, the absolute is not the relative. So the absolute number is what you really care. You don't actually care about relative, because if something is exceedingly unlikely to happen, 0 times 100 is still a 0. That's basically the answer to the zombification question. So now, of course, the devil is in detail. So I'm going to show you 2 tables. So and I'll tell you what you need to, how best to think about this. So the first table is this one. When you're seeing this abbreviation CHA, that's an AstraZeneca vaccine. The BNT right here, okay, that's the Pfizer, and then mRNA is the Moderna, right? So this is so whenever you see the green, it means that there was no risk. So, and on top, GBS is Guillain-Barré, TRM is myelitis, which I think is not even worth discussing because that's really, really rare. So BP is the Bell's palsy. It's kind of similar to Guillain-Barré in the sense that in Bell's palsy is just a phase, Guillain-Barré is a whole body, but kind of similar paralysis type of feature. Encephalitis is also a pretty scary situation, and then there are seizures. And then we'll look into my heart issues in the second table. So you can see that really the only 2 things were significantly here was that the AstraZeneca caused Guillain-Barré quite more, 2.5. And then, as you can see right here, the myelitis was much higher with Moderna. This encephalomyelitis. Now, again, because the frequency of that is so low, now, if you are indeed saying, I don't care, it's still 4 times or 3.78 times higher risk of acute disseminated encephalomyelitis, I'm going to not take that vaccine. Fine. See, Pfizer did not have that association. Why? I don't know. So you could arguably say, well, how do they know how accurate this data is? That's a great question. That's why they did 100 million subjects into the study. When you're looking at such a massive numbers, chances of error with each 100,000 decreases some. So in reality, when you look at massive numbers like this, the true error probably not going to be present simply because the sample is so big. However, there could be something very bizarre. There could be biases that are hard to predict. Maybe that because it's such a rare conditions, maybe people who were getting AstraZeneca were somewhat different for whatever reason, you know. And those are the types of biases that are very difficult to exclude. And again, because you hope that in such a large sample that it gets diluted, you're saying it's probably unlikely, but you have to disclose that because there is a chance of that. Okay, so this is somewhat of a different table. Actually, I think we're going to talk about 3 tables because this is the table with different clots. And again, see the AstraZeneca seems to be, it has most red and yellow. So yellow, it was a borderline, and red was significant. So I hope that that's a message here, right? And you remember me saying again and again, don't get AstraZeneca, get either Pfizer or Moderna. Here for the clots, Pfizer and Moderna seem to be performing very, very similar, but nothing really severely standing out. Now, the clots, on the other hand, are much more common occurrence, right? So they're not 1 in a million, they're maybe 1 in 100,000. So does that mean that the odds ratio of the 30% increase means a lot? You have to make that decision, but clearly there is a slight increase in clots all over, whether you take whatever you take, basically, in essence. And interestingly, the first dose was the worst, and the subsequent doses, that risk, for example, here in a dose 3 for the Moderna or the Pfizer's, was zero risk. In fact, in some cases, you can arguably say, well, look at that. That's 0.73. So it almost became a protective against the clot. So is that a real protection? Probably, because people simply were not getting the disease itself, and disease causes the clots, right? Because this is a longitudinal follow-up. So I actually do believe in some of these numbers, and I think that basically what happens when you get a vaccine protects you more than gives you side effect. That's what we're observing here, okay? And the last table is this one. Now, this is the only really, truly important, significant table, because you see the side effect across the board, and that's why they isolated it. Basically, all vaccines increase risk of inflammation of the heart. Now, that's not very common condition, unfortunately. And here's where I only have one practical message for everybody. If you had heart inflammation before, myocarditis or pericarditis, this is when you need to talk to someone. You don't want to take blindly these vaccines, because it seems like they're consistently, significantly increasing the risk. Look at the Moderna. Second dose increased risk 6 times, 600%. So, is this real? Yes, it's real for sure. How bad is this? Well, the good news is neither of these conditions typically deadly, and they usually don't leave permanent problems, but nonetheless, these conditions can be severe. They can easily land you into the hospital. They often do require interventions. They may require you to be out of the commission, out of work, and out of walking and doing things for quite a couple of weeks. So this is the only thing that pans out. I know that they separated adults and children. I don't want to talk about this in minutes, because I don't want us to spend more time. I want to move on, because I want to make sure we cover Q&A. Okay, I'm going to stop here with an article. I hope I've given this enough. Of course, we're going to give you an article. Janet, I don't know what's best. I'm probably just going to find a link. I think it'll probably be the easier, rather than sending you the full article. It is an open access article, so I can send the full article. I know we have a lot of people who are
just send a link.
Desperately want to read the whole thing. I will warn you, there's a lot of deep statistics that even I don't want to go into, because it's boring like hell. Okay, so I hope zombification criteria was explained appropriately. Everybody, happy Halloween, and let's do Q&A. I do see a very good point by Mark. The raw data is often obscured by company due to commercial sensitivity. This makes it really hard to do an accurate peer review. So this was a theoretically federally sponsored by UK study. Now, does that mean they avoided this bias? You can't be sure ever. Unfortunately, this industry is quite creative at ways they manipulate public's opinions. So, take it for what it's worth. And thanks, Mark, for an important comment. The data is data. It can be manipulated. It often is, and we can only look at what we get and make some decisions and understand that we're little fish in a big pond. We can only see a small picture of what's given to us. All right. So yeah, that's actually all I have in terms of for today. I think I went pretty fast, faster than I expected. So let's do Q&A, and if I don't have Q&A, we could potentially even end a little bit earlier. We do need to end a little bit earlier today, because actually I do have two other things I mentioned before I forget. We do have to finish a little bit early, because Janet and I, Lee and Dr. Pan are going to be doing a podcast right after this, because it's 100th podcast of GW, Office of Integrative Medicine podcast. So we decided we're going back to the past, going or to the future, however you want to look at it. And we're going to talk to John, see how all this happened, talk about history of integrative medicine. And then, of course, when that podcast is out, you're all going to be able to listen to it. So the two other announcements, they're not really now the topic, they're just announcement. We're going to have two back-to-back open houses, both next Friday and the Friday after. So Friday the 8th and Friday the 15th. The next Friday is a EDS and hypermobility open house virtually. The week after is a recode or a cognitive wellness open house. So if you, I will put the links to the Zoom, but if you really desperately don't want to miss this, please put your name, put your email in the chat and tell me which podcast you want to join, one or both, and I will actually send you an invite personally so you don't miss it, because once you get the invite from the Zoom, you can add it to your calendar so you don't miss it. We will be recording both, but there are two reasons why you want to join live. So one, you can actually ask questions. In recording, you won't be able to. And two, we potentially going to cut out some parts, because if the people ask personal questions, they're not going to be recorded. We will definitely make EDS public, but we're still debating. We may not make Recode public at all. There is a reason for that. As our Recode program has grown dramatically, we now have basically like a packaged care for these patients. And what we want to do is we want to include and give access to the recordings to the people who are basically paying members. So we haven't quite exactly decided how we're going to keep some of it open to general public. It's work in progress. So with that, and yeah, so you can put comments however you want to everybody, or just send them to me. So I will make sure I'll do that in the next half an hour. All right, still, I'm open to questions. Oh, one more thing. There is a resurge of COVID in California. Why? Unclear. How bad it's going to be, also unclear. It's weird. I wasn't expecting that. The thinking was that we're going to keep on seeing drop in numbers until January or so, just at least late December. Not, apparently looks like now we have this waxing and waning, but not disappearance of the COVID completely. So, it's unfortunate. Hopefully we won't have an early resurgence here in this area. And still no flu and RSV, as far as I'm aware. All right. I saw there's some comments. Right. So Mark puts very important comments. So the side effects have to be discussed in the terms of risk-benefit consideration. Again, this is why looking at the general statistics of side effects is so difficult, because you have to apply to yourself. And your side effects may have a dramatically different statistical probability than somebody else. Let me give you a simple example, and that's why I spent extra time concentrating on a heart inflammation, both myocarditis and pericarditis. Because if people already had the risk, or if they have some heart failure or some other problems, they may be at much higher risk for that. And those could be the patients who actually could be much more careful about taking vaccines, because it actually could. Think of it this way. One such a complication could end up being quite devastating, a lot worse than the COVID itself. But again, you have to measure the risk. All right. I think there was another comment. Okay. All right. Yeah, Jenny, thanks for I love this office too. The only problem, it gets poor temperature control. So when the sun comes in like this, even right now, it's really hot in here. So, which is kind of actually good, because it means only I can work here. Nobody else can use this office. I'm very temperature tolerant. I really care. Hot, cold, I'm okay. But Angela is not, and well, kids don't use this place at all. Okay, any recommendations for RSV vaccine? No, I don't have any updates for RSV. Again, only patients who are over 50 with pulmonary disease are the only ones I recommended for. It is different from how CDC recommends. I don't recommend even healthy 65 to get it again. This is different. It's a contradictory to what CDC ones. Now, those of you who follow the media quite a bit know that there was just an approval of GI bug called it's a virus that infects our intestines that causes diarrhea, right? A norovirus, and so they just got approved the mRNA vaccine for that. So it seems like we're going to start having a flood of mRNA vaccine for all kinds of things. That doesn't mean you should be running and getting them. The point is, this vaccine seems to be very strong in immune activation. It's essential that you very carefully consider these risks, right? You don't want to be zombified for some minor reasons and end up with something that's causing problems just because you're trying to avoid a diarrhea that usually self-resolving after a week or so. So you have to think about this. Now, RSV could be very serious. It could be deadly in the patients who are predisposed to severity. That's why somebody with known pulmonary disease should seriously consider getting this. Okay, it's strange. Pneumonia is still going around. Oh yeah, that's not a pneumonia, it's a bronchitis, I would call it. So it's some kind of a viral process that turns more commonly into bronchitis. I think it's slowing down. I've only seen one patient in the last couple of weeks with it, so I would say it's titrating off or dropping off slowly. But yeah, but exactly. So I think that's just that we had that early fall, late summer, strange upper respiratory infection that was turning into bronchitis, and a lot of people, I think, were at the tail end of that. That is not RSV. Just want to say, RSV looks a lot more severe, almost always, especially in young kids and in susceptible individuals who are having pre-existing pulmonary problem, lung problems. All right. Well, I think, Jen, what do you think? If there's no more questions, should we give Catherine a floor a couple of minutes early?
Yeah, I think so.
See, I did good. You didn't even have to kick me out.
Hey, Misha. Hey, Misha, can I sign up for both podcasts?
Yeah, I see. I saw everybody's messaging. I'm gonna be gradually adding everybody. Don't worry.
Okay, thanks.
And it's not too late to send me a message during right after Catherine. So with special pleasure having Catherine with us once again. You guys for a very, very special treat. As you know, Catherine has special place in my heart for her practices. So I'm very excited she's here. I don't know how I'm going to juggle this, but I will try because I need to invite people, but I really want to do the practice you have to offer us today. Thank you for joining us.
Of course. Thank you so much for having me. And hopefully you can at least get a couple minutes as you're prepping for the podcast. Thank you all so much for being here. We'll do a few different exercises and then we'll close out early in preparation for what's happening at 3. But I invite you all to come into a comfortable position. So if you need to move away from your screen or if you want to remain seated where you are, maybe move to a couch, someplace where you can recline, I invite you to do that now. Anything that helps you just feel more relaxed, feel more comfortable. Feel free to turn your screen off if you prefer that as well. And as you come into your comfortable position, if you want to grab any pillows, blankets, cozy sweater, anything that you need.
We all agree that Montana is one of the
If everybody, please make sure you mute it.
I apologize. Something else was playing on my computer. I have no idea what it was. I'm so sorry about that. Okay. So as I was saying, if you need a moment to grab any supports or anything for yourself, I invite you to do that now. And we'll begin by first, let's just take some stretches in the body as we need them. If you want to perhaps maybe raise your arms up overhead, maybe interlace the fingers, press the palms up towards the sky, and just maybe stretch them gently side to side. Maybe if you want to bring your arms in front of you, stretching your arms that way. Maybe rolling the shoulders from the front to the back. Maybe rolling the shoulders from the back to the front. Maybe even drawing the head side to side, or maybe doing some neck or shoulder rolls. Or maybe even taking a gentle twist in the spine. Maybe there's another stretch or movement that feels good for you right now. And again, I invite you to find what feels good for you. Taking about another 5 rounds of breath. Moving, stretching. We're doing this just to perhaps release any energy, anything that we need so we can more fully and deeply relax. As you begin to close out your movements, I invite you to settle into wherever you are. Let's take a deep breath in through the nose and exhale, sigh it out through the mouth. Do 2 more deep breaths in through the nose. Exhale, sigh it out through the mouth. And again, deep breath in. And exhale, sigh it out. Allowing yourself now to breathe gently, to breathe fully, in whatever way that feels like for you. Feeling your breath perhaps take up the fullness of your belly, your lungs, your upper chest. And then feeling that exhalation as you breathe out fully from your upper lungs, maybe perhaps all the way down to your belly. Do this a few more rounds. Deep breath in through the nose. Filling up your torso. And then breathing out. Release. Breathing in fully. Breathing out. Release. Breathing in fully. Breathing out. Release. I invite you to breathe on your own like this for the next minute or so, allowing yourself to take full control and reign of your breath and fully immerse yourself as you breathe. So often we are pulled in all different directions. So often we are not invited to focus on this internal process. So take this time, savor this time as you breathe in and breathe out. I'll move into this guided relaxation. For this practice, we'll be practicing anchoring. So I'll guide you through this. If at any point this does not feel comfortable for you, or if something else feels more comfortable for you, of course, I invite you to tune me out. I invite you to do what feels good and best for you. So here, I invite you to breathe in and out, continuing this breathing practice as I guide you through this relaxation. As we've already begun to stretch out and move in our body, I now invite you to begin to stretch the muscles of your face. Perhaps as you open your mouth wide and breathe in, perhaps even yawn if you wish. Stretching the muscles of your face and allowing your face to slacken gently as you breathe out. Relaxing completely. Allow your lower jaw to hang loosely below your upper jaw, allowing your teeth to not touch. As you continue to breathe, scan your body for areas of tension as you take another breath in. Maybe there's tension in the lower half of your body, in your shoulders, in your neck, in your back. Wherever it is, feel the tension in your body as you hold that breath in. And allow the tension to release and float away as you let the breath go. As you continue to breathe, point your toes, stretching your legs. Release the muscles of your legs and relax. Now bring your feet upward, toes pointing towards the shins, stretching the backs of your legs. Release the stretch, relaxing your legs completely. We'll do this one more time. Point the toes, stretching out the legs, and release the muscles of your legs as you relax. Now bring the toes upwards towards your shins, stretching the backs of your legs, and release the stretch, inviting relaxation into your legs completely. Allow your legs to become limp, loose and relaxed. Allow your arms to become relaxed and loose. Breathe and notice how your body feels. Feel relaxation flow through your body. Notice that you can become even more relaxed. Perhaps wiggle your toes once or twice, and then allow your toes to be still and relaxed. Feel relaxation flowing, spreading, until your feet are relaxed as well. Allow the relaxation to continue up to your ankles. Feel how loose and relaxed your ankles feel. Now invite the muscles of your lower legs to give up their hold. Feel relaxation in your lower legs. Calm, relaxed, heavy, relaxed. Enjoy the feeling of relaxation as it flows to your knees, then to your upper legs. Notice your thighs and legs relaxing and letting go. Your legs feel heavy, very heavy, and very relaxed. Feel relaxation flowing. Allow your sits bones to relax. Your pelvic area to relax. Your abdomen to relax. Feel the muscles becoming loose and relaxed, letting go of all the tension. Relaxed and heavy. Allow your lower back to relax. Feel relaxation there as the muscles of your low back give up their hold, leaving nothing but relaxation, calm, peacefulness. Invite relaxation to continue to flow throughout your body, moving to the muscles of your sides. Feel your abdomen, sides, and chest moving in and out more gently with each breath. Each breath making you even more relaxed. Allow the muscles of your sides to let go. Feel relaxation filling your core, relaxing your chest and stomach, your middle back, upper back. Feeling more and more relaxed, pleasantly relaxed in your shoulders, your upper arms, your elbows. Notice your arms relaxing, becoming heavier. Feel this in your lower arms, your wrists, your hands. Your arms become completely limp and relaxed, pleasantly relaxed. Feel relaxation flow from your low back to middle back to upper back to your neck, the back of your neck, the front of your neck, the back of your head, the top of your head, your chin, face, jaws. Notice the cheeks relaxing, becoming completely loose and relaxed. Notice your lips relaxing, becoming soft and relaxed. Your tongue relaxed. Nose, eyes, eyelids are heavy and calm. Feel your eyebrows relaxing, your forehead becoming smooth, cool, and relaxed. Your whole body is now fully relaxed. Enjoy this relaxation you're experiencing. If it feels comfortable for you, use your left thumb and 2 fingers to gently squeeze your right thumb, while at the same time silently say to yourself, relax. Anchoring this feeling of relaxation to this spot. Notice the feeling of deep relaxation as you breathe. Noticing your breath without trying to change it in any way. Notice how calm, peaceful, regular your breath is. And as you breathe in, say in your mind, I am relaxed. As you breathe out, mentally say to yourself, I am calm. Breathe in as you say, I am relaxed. As you breathe out, say in your mind, I am calm. I am relaxed. I am calm. Once again, squeeze your right thumb as you say to yourself, relax. Let the anchoring in this spot become associated with peaceful, a peaceful, relaxed state. And each time you squeeze your right thumb, say relax and feel the relaxation deepen. Continue to allow the relaxation to flow throughout your body. Calm, peaceful, relaxed. Memorize this feeling of relaxation. Notice how your body feels. Notice how calm you are in this moment. Create a picture in your mind of the state of relaxation. And with this image in mind, once more squeeze your right thumb while saying to yourself, relax. Feel the relaxation deepen. You are as relaxed as you want to be, as calm and relaxed as you want to be. Warm, safe, comfortable, relaxed. Now invite you to begin to become more aware of your surroundings. Keeping your eyes closed, slowly allow your body to begin to reawaken with any gentle movements or stretches that your body needs at this time. Know that in the future, you can always return to this place of relaxation by squeezing your right thumb and calling to mind the feelings and memories of how relaxed you were during this practice. Slowly becoming more awake, more alert, more energetic. As you breathe in, awakening more. And as you're ready to resume with your day, allowing your eyes to gently flutter open as you feel rested and alert and ready to go. Thank you all so much for allowing me to guide you in this practice. I apologize for the little sound snafu at the beginning, but hopefully this has been a nice moment of calm and peacefulness in your day, and that it will prepare you for whatever you have in the hours to come in the rest of your day. Thank you.
Thank you, Catherine. Misha must be very mellow because he's gone. Okay, so everybody, next week we will have with us Jennifer Rio and Dr. Eileen Yeager. So please tell your friends, tell your family. They are both amazing, and they've been with us before. So we'll see you next week. Misha, did you have anything to say?
I'll stay here for a minute if anybody needs something. We still have a
Okay.
couple minutes left. Catherine, thank you so much for wonderful, as always. Absolutely best
Thank you.
practice. And stay tuned for the podcast. And I think I invited everybody. So if I miss somebody, you can email me. If you didn't get an email,